Hello. I'm Dr. John, and this is the channel where health and education meet. Have you noticed any changes in the color of your nails or any strange tones on the skin of your feet? What may seem like just an aesthetic detail could actually be a warning from your body about serious liver problems, and understanding these signs could be the first step in preventing health complications. In this video, you will discover how your own body reveals important clues about your liver health and what these signs might actually mean. Imagine being able to identify internal issues in your body before even feeling severe symptoms, just by observing subtle changes in your feet. I'll show you what each change can indicate, like yellowing, dark spots, or even changes in your nails. You'll learn how to interpret these signs in a simple way, understand the risks involved, and, most importantly, how to act preventively to protect your liver. If you're feeling constant fatigue, swelling in your legs, or have noticed changes in the texture of your skin, this video is for you. Stay with me until the end, because this information could help you take better care of your health, avoid future problems, and understand your body like never before. The liver, this vital and multifunctional organ, plays an essential role in filtering toxins and regulating nutrients in the body. When it's not functioning properly, the body finds subtle but visible ways to signal that something is wrong, and the skin and nails are like mirrors of internal health. A change in color or texture, no matter how discreet it seems, could be a sign that your body is trying to communicate, something most people ignore until the signs become severe. Imagine the liver as a purification center for your body. When overloaded, it fails to process toxic substances efficiently, which can result in the buildup of bilirubin, a substance that alters the color of your skin and nails. It's as if the body starts to leak external warning signs. And we're not just talking about a slight change in tone. Dark spots, peeling, and even abnormal shine can be valuable clues about liver health. By understanding this connection, it becomes easier to pay attention to everyday details. Have you ever noticed someone with whitish nails or more yellowish skin and wondered why? These signs could be the beginning of something more serious, and learning to interpret them could be a way to act preventively before the problem worsens. And when the most classic sign appears, like yellowing of the skin, it usually indicates a specific and concerning condition. Jaundice is one of the most obvious signs that something may be wrong with the liver. It occurs when bilirubin, a yellow pigment produced during the breakdown of red blood cells, builds up in the blood due to liver dysfunction. This excess manifests itself through a yellowish tone in the skin, eyes, and even nails, creating a clear visual alert. It's like the body is lighting up a warning signal, asking for immediate attention. This symptom, however, goes beyond aesthetics. In many cases, yellowing is related to serious conditions like hepatitis, cirrhosis, and bile duct obstructions. Imagine a clogged faucet. When the flow is interrupted, the water starts to accumulate and overflow. Similarly, when the liver doesn't process toxins properly, the body reacts externally. This symptom is often accompanied by extreme fatigue, nausea, and even abdominal pain. If someone notices this yellowish color, it's crucial to seek medical advice as soon as possible. Jaundice could be the first visible stage of more severe liver problems, and early diagnosis makes all the difference in treatment. But what happens when it's not the yellowing, but an extreme paleness in the nails and skin? Whitish or extremely pale nails can be an indication of a more advanced liver problem, often linked to cirrhosis or chronic liver failure. This change occurs due to a reduction in the liver's production of essential proteins like albumin, which directly affects blood circulation and tissue nutrition. When the liver is compromised, blood flow to the extremities is reduced, resulting in this paleness that goes beyond just a lack of color. Think of the nails as silent thermometers of health. When they lose their natural color and take on a dull or milky appearance, it could indicate that the liver is struggling to maintain internal balance. It's as if the body is redirecting vital resources to the most essential organs, leaving the extremities in second place. This symptom can also come with weakness, dizziness, and even fluid retention, which highlights the need for careful diagnosis. Ignoring this sign can be risky, as pale nails are not just an aesthetic issue. They may reflect a severe deficiency of nutrients and proteins in the body. Observing these changes and seeking medical help quickly could make the difference between effective treatment and the worsening of a silent condition. But what about when the nails show dark spots or even a purplish tone? Dark spots or a purplish tone in the feet can be clear signs that the liver is not adequately performing its role of filtering and regulating blood. When the liver is compromised, blood flow can be impaired, leading to poor oxygenation in peripheral tissues, especially in the extremities like the feet and nails. This symptom can indicate anything from liver failure to more complex issues like portal hypertension. Picture a congested road. When the flow of vehicles is blocked, the buildup creates slowdowns and even complete stops. Similarly, when blood doesn't flow efficiently, it can accumulate, leading to these spots and discolorations. Many people neglect these signs, attributing them only to poor circulation or fatigue, when, in fact, they could be an early warning of serious liver overload. The appearance of these spots, especially if accompanied by swelling or a feeling of heaviness in the legs, deserves immediate medical attention. Deterioration in circulation could indicate complications like hepatorenal syndrome or even thrombosis. Recognizing these signs early could be the first step in preventing more serious problems. But what should you think when your nails begin to show deformities, such as thickening or marked lines? Nails that become thick, wavy, or show prominent lines can be reflections of chronic liver problems. These changes occur when the liver progressively loses its ability to synthesize proteins and regulate nutrients in the body. The result? Irregular nail growth, often with vertical ridges or a deformed shape, indicating deep biochemical imbalances. Think of nails as living records of your health. Just as trees form growth rings that reflect seasons and periods of stress, your nails carry information about what's happening inside. When deep lines or thickening appear, it may be related to a buildup of toxins in the body due to an overloaded liver, especially in cases of chronic hepatitis or advanced cirrhosis. However, these signs don't appear alone. Deformed nails, when combined with symptoms like constant fatigue, dry skin, or swelling, indicate a systemic condition. The body is trying to communicate that something is wrong, and ignoring these signs may delay important diagnoses. But what if the problem isn't with the nails, but with the visible swelling in the feet and stretched skin? This may indicate something even more urgent. Swelling in the feet, accompanied by visibly stretched and shiny skin, can be a red flag for severe liver problems like ascites. This condition occurs when the liver, losing its ability to filter and regulate fluids, allows fluid buildup in the body. Initially subtle, the swelling tends to worsen progressively, affecting not only the feet but also the legs and abdomen. This symptom can be compared to a reservoir that, without an appropriate control valve, starts overflowing. The liver's inability to produce albumin, a protein essential for maintaining fluid balance, causes plasma to leak from blood vessels and accumulate in tissues. Often, this retention is accompanied by a feeling of heaviness in the legs and difficulty walking, clear signs that the body is overloaded. Ignoring the swelling can be dangerous because it tends to progress silently. The stretched and shiny skin indicates a significant fluid buildup, which can lead to complications like infections or acute liver failure. Staying alert to this symptom and seeking immediate medical evaluation is crucial. But what about when the body gives more subtle signals, like itching or slight changes in skin texture? In addition to visible changes in the nails and skin, the liver can manifest problems through more subtle, but equally important, signs. Persistent itching without explanation, red spots on the palms of the hands, and even slight darkening around the eyes can indicate that the liver is overloaded. These manifestations are often ignored, but they reveal imbalances in liver metabolism and the accumulation of toxins in the body. Consider the liver as a vital filter that, when clogged, begins to let residues escape to other parts of the body. Itching, for example, can be caused by the buildup of bile salts in the bloodstream, a classic symptom in conditions like cholestasis. Red spots on the palms, known as palmar erythema, appear due to the dilation of blood vessels, signaling possible failures in the liver's hormonal regulation. These signs, although less obvious, should not be underestimated. Observing your body and noticing these changes could be the key to early detection of serious liver diseases. After all, the body always communicates, and it's up to us to pay attention. But how can we be sure that these signs really point to liver problems and aren't just normal variations? That's where the importance of a specialized medical diagnosis comes into play. Although liver signs can be noticeable in the nails and skin, the only way to confirm an accurate diagnosis is through medical tests. The liver can be affected by a range of conditions, from viral hepatitis to more complex diseases like cirrhosis. Early detection of these issues is crucial to avoid more serious complications, such as liver failure or liver cancer. Tests like ultrasound, CT scans, and liver function tests can provide detailed information about the state of the organ. Ignoring the signs and hoping they'll go away on their own can be dangerous. The liver, being a vital and resilient organ, can compensate for damage for a considerable amount of time before more serious symptoms manifest. Many people don't realize that by delaying a medical consultation, they are allowing the problem to worsen silently. Routine exams, such as liver enzyme tests and cholesterol monitoring, are essential to detect any abnormalities before they become irreversible. Investing in liver health doesn't just mean treating diseases but preventing them from developing. Regular follow-ups with your doctor, especially if you have a family history of liver disease or other risk factors, are among the smartest steps to ensure a long and healthy life. But the real question is, have you scheduled an appointment to check the state of your liver? Now that you understand how the signs from your body, like changes in nails and skin, can indicate liver problems, it's time to act. Don't wait for tomorrow to address what can be identified and treated today. If you've noticed any of these symptoms or feel that your body is giving warning signs, see a doctor and get the necessary tests to ensure your health is in good condition. Early detection is always the key to recovery and living a healthier life. And remember, it's not just about treating diseases but preventing them from developing. Take care of your liver, take care of yourself. And if you enjoyed this content and want to continue learning about how to detect health problems before they become serious, subscribe to the channel and turn on notifications. Don't miss any video and continue informing yourself to live longer and better. Now, take a moment and think, are you doing enough for your health? How about starting today?